The invitation.
Good evening, everyone. Good evening, everyone. A warm welcome to Venibushan Memorial Oration. For this, first I call upon the dignitaries onto the dais. I call upon Dr. K.Gopalakrishna, sir, President of our association, onto the dais. Next, I call upon speaker of today's evening, Dr. Navin Pawaskar, sir, onto the dais. Now I request General Secretary of our association, Dr. G. Durgaprasad Rao, sir, onto the dais. I request President of our association to welcome the audience and give the introduction about Venibushan Memorial Oration.
Rallabandi. Exams జరుగుతున్నాయి. ఈ ఫస్ట్ ఇయర్ స్విట్జీ అక్కడ మన
గుడ్ ఈవినింగ్ లేడీస్ అండ్ జెంట్మెన్.
సైఫాబాద్.
Respected distinguished speaker of this evening, Dr. Navin Pawaskar, Director, GIMS Homeopathic Medical College, and our General Secretary, Dr. Durgaprasad Rao, and eminent people and professors, student friends, colleagues, I extend a hearty and warm welcome to Venibushan Memorial Oration on behalf of our team HMAT and our association. Veni Bhushan Memorial Oration was sponsored by Dr. K. Shivashankar Garu in memory of his beloved son, Sri Veni Bhushan, to around 2 decades ago. Since then, we are regularly organizing this oration, inviting eminent people to deliver orations over the years. So on this occasion, we pay our heartful homage to Sri Veni Bhushan, and we also profusely thank Dr. Shivashankar Garu and his family for sponsoring this event. And today, we have Dr. Navin Pawaskar, who is going to deliver an oration regarding cardiac ailments and usefulness of homeopathy. So this particular topic is, in fact, very much needed for all the practitioners and students to know about. So we are eagerly waiting to hear him. And along with this, we are also having another small program. This month happens to be the birth month of Dr.N.Linga, so who was a stalwart and a great teacher of Organon. So commemorating his birth anniversary, we have proposed to felicitate the eminent teachers in and around Hyderabad working in medical colleges. So we are very thankful for responding to our request. The organon of medicine, how important it is for a homeopath and for a homeopathic practitioner, we all know. So to once again uphold that understanding, we thought it would be befitting for Dr. Constantine Herring. So we profusely thank all the respected professors for having come and accepting our invitation. Thank you, one and all. Thank you.
Thank you, sir. Now I request the secretary of our association to speak a few words about HMAT.
Good evening, all. Respected President Dr. Gopalakrishna sir, our beloved speaker Dr. Navin Pawaskar sir, distinguished guests and doctors. Today, let me pay my tributes to Veni Bhushan, on whose memory this oration is being held today. And you know about the HMAT activities. We run the CL Modi Charitable Dispensary every day throughout the year. It has been running for the last 55 years and with OP. And recently, some few years back, we started our specialty clinics also by senior doctors who are rendering their honorary services regularly without break. And apart from the OPD services and specialty clinics, and we train the internees also. Those are posted by the different colleges like Dev's College, Hamsa College, MNR College, JSPS College, like that. And from shortly, we are going to start a special clinical apprenticeship program called the Senior Internship Program. What the need of this program is, because as the internee, when the doctors come to the postings, they stay here for 1 month only, and from here they shift to other place also. And within the tenure they shift to every month, every place. They will be changing place by place. And keeping that in that view, we thought to give a special senior internship program as a clinical apprenticeship to the regularly completed internees to have some 6 months or 5 months or 6 months course practical aspect of the practice, and they can take the case on their own and they can analysis, they can prescribe the medicine, they can follow up the case till the last. So we are shortly going to announce that program, and we have already made a curriculum, and it is going to be installed shortly. And apart from these programs, we also run the medical camps and epidemics. During the epidemics, we give preventive medicines right from brain fever to recent COVID also. We have been successfully distributing free preventive medicine for all epidemics and pandemics. And these are our activities. And we do conduct national and state level seminars periodically by inviting the esteemed doctors of from Twin Cities, and not only Twin Cities, from all over India. And during the COVID also, we have continued our orations through our Zoom meeting, and it has gained a popularity pan-India, pan-world also. Even from other countries also, they use it to attend the Zoom programs. So all these activities are running under the heading of our beloved President Dr. K.Gopalakrishna sir. And I thank all the CL Modi Charitable Dispensary and specialty clinic consultants and all the other elders who are donating some by kind words and money for the development of our organization. And I thank you. I thank you for giving me this opportunity.
Thank you, sir. Now I call upon Chamundeshwari to introduce our speaker, Dr. Navin Pawaskar, sir.
A very good evening, one and all. Dr. Navin Pawaskar, sir, a renowned healthcare consultant, and he provides consultation to over 40 plus organizations from the year 2013. He is the director of Jim's Healthcare from the year 2013. He is the director of Parimal Projects Private Limited, and also he is the director of Validus Healthcare Private Limited. Director RE Integrative Healthcare Private Limited from the year 2020. He is also the founder director of Primary Healthcare Foundation from 2021. He has experience of over 28 years in hospital-based clinical experience and over 10 years in disaster and emergency management. He has experience of over 20 years in administrative experience. He is the member of Expert Committee National Commission for Homeopathy. He is the member core committee for electives. He is the member CCRH Central Ethics Committee and he is COVID Task Force Ayush member. He has a renowned publications such as Principles of Integrative Medicine and he is the author of History of Medicine and Homeopathy. He is the author of Repertory of COVID-19 and he has publications of over 40 plus scientific writings in various journals. He has 5 research papers published in index journals in his account. He is also a renowned awardee in Vocation Excellence Rotary International in the year 2005, Service in Action University of North California, USA in 2013. He has the award of Vaidya Seva Ratna Elders Club International Foundation in the year 2022, and he also won the Homeo Garu Puraskar Education Award from IIHP in the year 2023. Now I call upon our renowned speaker, Dr. Navin Pawaskar, sir, to take over the session.
Hello, am I audible? Thank you. Sorry. Yeah, sir. Notes. Yeah. Big change. Acha, so you want me how you want which way? All right. So first of all, let me thank HMAT and the organizers, chairman and secretary sir for inviting me here. And let me congratulate all the awardees of today for their dedicated and wonderful teachings in Organa. Okay. So let me thank the organizers and as well as congratulate all the awardees for their excellent work that they are doing, and because of which they are being awarded this award for today. And I hope that they will be inspired to do better and better work in the coming future. Now, I'll come straight to the topic. This is about role of homeopathy in common cardiac diseases. So, by and large, why do somebody come to a homeopathic doctor for cardiac illnesses? So I'm just going to give you a few cases where why people approach homeopathic doctors. So this is about a 60-year-old female who is retired, known case of diabetes with retinopathy and nephropathy, recently diagnosed as typical angina, angiography suggestive of normal coronary angiogram, but the stress test is positive, thallium scan is positive, suggestive of microvascular angina. Now for this, there is not much to offer in modern medicine, and that's why this particular lady came to a homeopathic doctor for treatment of her angina and IHD. This is about a 70-year-old retired known case of IHD, underwent coronary artery bypass graft, and post bypass was asymptomatic, but recently again developed chest pain and again diagnosed as angina. So this is the second occurrence. What happens is people do visit, do the conventional treatment, and once then there are secondary symptoms. When the symptoms occur in spite of the conventional treatment, that is the second scenario in which patients actually try and visit homeopathic doctor. First case I showed you where people visit because there is very little to offer in modern medicine. Microangiopathic anginas, very little to offer. Apart from blood thinners, there's nothing else. So if you are symptomatic, you still need something more than just the blood thinners. So that is why they come. This is where the CABG is done. 5 years, the patient has been good. But again, there is a recurrence of symptom. So now what next? So this is where they come. Now, case 3, 45-year-old male, an executive with a smoker, under a lot of emotional stress, precipitated chest pain. ECG reveals ST segment elevation, diagnosed as Prinzmetal's angina. Considering his age, his risk factors, and his emotional stress, he's been advised conservative line of treatment with lifestyle modification. Now, these are the ones who would come to homeopathy because they need not just the treatment of angina, but something more than that. The entire conservative line of treatment would be your constitutional line of treatment with lifestyle modification. Now, here's the fourth occurrence. The 60-year-old female with rural background, diagnosed as angina, positive stress test, diagnosed as triple vessel disease, advised CABG, but patient refusing operations for financial reasons and out of apprehension. So this is the fourth scenario. There is a line of treatment offered, but the patient cannot either afford it or is too apprehensive to undergo the knife, and hence they don't want to undergo surgical treatment. That's the reason that they choose to come to an alternative therapy or homeopathy. And here's case 5, where 2D echo reveals cardiomyopathy. Not much to offer in modern medicine for cardiomyopathy, and that's the reason why they come. So I showed you 5 different scenarios in which a patient usually chooses alternative or homeopathic medicine over the modern medicine because for the patient has progressive primary myocardial disease like cardiomyopathy, where very little is there to be offered. Patient has recurrence of symptoms following a cardiac intervention like PTCA or CABG. Patient refuses to undergo surgical intervention after being indicated and offered as main line of treatment. I showed you case 3, which was the same one. So these are the patients where young hypertensive following a cardiac event resorts for lifestyle modification, managing the stress, managing the addictions. Patient wanting to undergo cardiac rehabilitation with primary and secondary prevention. So these are usually, people would normally say, who comes to homeopathy for cardiac treatment? No, these are practical scenarios where people come for homeopathic treatment after either after they have received modern medicine or because modern medicine has limitations and they look at us for the treatment. Now, this is the statistical data present in, CVS OPDs in homeopathy. Around 90% of patients come for hypertension, around 3%, less than 5% around come, 0.5% come for CCF, around 3.5% come for around IHD, and so on and so forth. If you can see rheumatic wall disease, around 2.5%, and primary myocardial diseases around 1%. So, you will get the stats if you look at the hospitals and understand why or what kind of patients come for homeopathy. So mostly it is hypertension and its complication or primary myocardial diseases like cardiomyopathy. Now, what is the difference between homeopathy and allopathy? I think most of you know, most of you are teachers. And so here the main important aspect is the concept of individualization and the concept of biopsychosocial model that we use as compared to what is the typical model in homeopathy. Common question that is asked, is homeopathy averse to surgery? I think homeopathy believes in surgical intervention where there are structural irreversible changes in tissue requiring mechanical correction to set the anatomy right. This is a very clear fundamental issue. So the answer to whether homeopathy and surgery go well, in indicated cases, they would go well. But in unindicated cases where you have scope for conservative management, we should go with the conservative management. So what is primary prevention in cardiac event in a person who is at high risk and hence predisposed to an acute coronary event? We'll see through this particular case. So this is a 52-year-old male who's a known asthmatic. He's on homeopathic treatment and inhalers, works in an operation theater as an assistant. He develops severe occipital headache since last 4 to 5 hours, has severe chest discomfort and grade 3 dyspnea. His blood pressure is not a known hypertensive, but his blood pressure is 180/30 with a pulse rate of 100. He has bilateral bronchitis and there is severe tachycardia. Now, this is the situation in which he comes to you. There is T-wave inversion in 2-3 AVF. So that means there is inferior wall ischemia as well. Lipid profile is also showing dyslipidemia. Rest of the findings are okay. He's already received some medication from his doctor who has given him Depin 5 milligram 4 hourly, but that is not reducing his blood pressure. His blood pressure range continues to be 170/190 and 110/130 diastolic. And he's symptomatically also not relieved. There is restlessness and sleeplessness due to the pain and headache. Now, how do we approach? Approach is always very, very simple. We found out actually what triggered this sudden rise of accelerated hypertension. So patient is saw anesthetist arriving in an operation theater for an emergency operation, and the operation was about an amputation of an infected foot due to Hansen's with cellulitis and maggots. He is a person who, and the patient was shocked because of sudden arrival of anesthetist. We understand the preceding event that led to trigger of hypertension. He is an anesthetist assistant. He saw anesthetist arriving, that his boss arrived without prior notice for an emergency operation of an amputation of infected foot which was due to Hansen's, had cellulitis and maggots. And once the patient stepped in, there was a very strong offensive odor that triggered and aggravated the headache. So what is the preceding event? 2 events. One is sudden surprise that now the boss has arrived and I need to get things moving. That suddenly triggered the headache. And then there was strong offensive odor with the patient. If you would have seen cellulitis with gram-negative infection, gram-positive infections, gram-negative and gram-positive infection, you will realize that there is extreme odors that they exhibit when they come, and there were maggots as well. So now what do we do? It's very simple. How do you look at it? There is shock and there is surprise. And that has, the other aggravating factor has been the strong odor. And how has the patient presented? One is accelerated hypertension, two is severe occipital headache, and a triggered hypertension in a non-hypertensive patient. Right? He's already taken antihypertensives which were given to him by his clinician, which he is not responding. And that is the reason why he is come to us. So ailment from headache from emotional excitement after, headache, congestion, emotional excitement after, ailment from shock and surprises, sleepless and uneasiness, head pain, occipital region, congested head pain from congestion. Now, to just simply repertorize this, you get all these remedies which are basically remedies for excitement. Right? What are the remedies for excitement? Coffea cruda, ferrum metallicum. Right? These are all remedies which are there for excitement. So you will get all these remedies like Glonine, Rauwolfia. These are the remedies which are there for remedies that come for excitement. Now, the main problem is how do we really find out which amongst them is the one that will be required for this particular incidence? So, Coffea, Naxwamika, Pulsatilla, Viratrum, Gelsemium. If you see Coffea, Gelsemium, Ferrum, Glonine, all are excitable remedies. But what is the thing about Coffea? Coffea is all about pleasant surprises. And this is not a pleasant surprise. Right? Coffea's excitement is all neurological excitement. So you will see triggers of neurological factors coming into picture, whereas here what you see is a cardiovascular excitement that has happened. You can also think about aconite if you wish to, but in aconite there is great panic. Here there is no panic. Here there is clear excitement and shock. Gelsemium is another remedy which has got ailment from, unpleasant surprises. And Gelsemium also has got headaches. But the other concomitant to the Gelsemium is always the drowsiness, dizziness, and there's not so much of cardiovascular excitement. There is more of cardiovascular slowing down. Now, Glonine has a lot of cardiovascular excitement. It has, rush of blood to the head. But Glonine's vulnerability is mainly to environmental factors like heat and light. Right? It doesn't have so much of a surprise element that creates this kind of excitement. There is violent palpitations, ebullitions that is felt across in the skin. But more important is that it has exciting factors which are more from the environment. And the characteristic feature is not so much is palpitation. Now you look at the remedies which have got, other remedies which have got excitement. Now, in that you have Ferrum metallicum and Viratrum album. Ferrum metallicum is a remedy which gets excited, causes anger, has flushes if you remember, and then causes headache. Whereas Viratrum album or Viratrum group has sudden surprises, shocks, sudden rise of hypertension. The more important thing is erratic effects. Viratrum is erratic. It's an erratic remedy. So you never know how the remedy is going to react to the trigger. But the main sphere of action for Viratrum is cardiovascular thing. And most important thing around is the nuchal headache, the headache at the occiput. Right? And retracted head. The patient will retract its head due to pain and congestion. So what is the remedy that we want? We want a remedy which has got shocks and surprises. We want a remedy which is reacting strongly to odor, which is sudden rise of blood pressure. That suddenness is very important, and whose sphere of action is at the base of the brain where there is congestion. Right? Viratrum, hellebore are all hellebore group of remedies which has strong, ANS and PNS action on the blood vessels. And Viratrum viridi has a very specific action at the base of the brain. And that's the reason that we prescribed Viratrum viridi to this particular patient. Now, more important to see here is what happened to this particular patient. We just gave Viratrum viridi single dose and waited. Because why? The reason is very simple. The causation was available to us. We knew why this had happened. Is not a known hypertensive, but the risk of this blood pressure, going into some sort of a cardiovascular complication was very, very high. And that is the reason we admitted the patient, gave a single dose of Viratrum album and Viratrum viridi and waited and watched. I think I've missed the slide of follow-up in this particular case, but I can tell you, if I find that, I'll show you across. With single dose of Viratrum viridi, the blood, and we measured blood pressure every hourly, single dose over a period of 6 to 8 hours, without amlodipine being used, the blood pressure gradually fell down and the patient could relax and sleep. Now, that is what happens when you give. I'll try and find out my follow-up slide on this and I'll show it to you. But this is what happened with after a single dose of Viratrum viridi. Again, the question would be, if the blood pressure is so high, why didn't you repeat? Why didn't you, use multiple dosages? Once you know the causation and once you know the reaction to that particular causation, and this is a very pure psoric response that we can see, but has a so we don't need to really repeat in this kind of cases and allow the patient to respond to a single dose. Wait and watch, make sure he doesn't go into some complication. And that is the reason why you need to admit this kind of patients. Now, so what I'm trying to say here is, what we prevented here is not only brought down the hypertension and gave a symptomatic relief to this particular patient, but we also avoided patient going into secondary complication. And that's the reason I'm saying the scope is lying in preventing a secondary complication that can happen because of hypertension by acutely controlling the hypertensive response. Now, constitutional therapy, our aim and objective is to modify the pattern of response of the host to the environment. Hence, we have to study the host in the sense the patient completely from all angles, from the level of mind, body, pathology, and practice the principles of individualization to treat these particular cases. In this, the therapy can be used as adjuvant as well as individually to reduce the symptomatic treatment or bring down the cardiac symptoms. At the same time, also, if you're using it as an adjuvant, you can bring down the cardiac drug load and improve the compliance of the patient. This therapy is useful in altering natural course of the disease in chronic cardiac diseases. And this therapy is also useful in patients who are not fit for surgery or who opt out from the surgical. So just to demonstrate what we are trying to say by constitutional treatment, this is a patient who is a 50-year-old female who came complaining of chest pain in the mid-sternal region, pricking type of pain, and which radiated to both the shoulders. The pain was of moderate intensity and starts after patient walks around 5 to 10 minutes or if he overexerts. Pain along with palpitations, restlessness requires deep breathing. Occasionally, pain subsides within 10 to 15 minutes after he stops walking. Patient has severe perspiration after pain. Now, this is typically what he presented with. This is the detailed ODP of his. More important, there was no history of previous difficulty in breathing, no respiratory infections, no orthopnea, PND, etc. Chronic smoker and occasional drinker. Now, more important, what I want to never miss to examine the patient completely when you have any sort of cardiac illness coming to you. We ruled out any acute episode of myocardial infarction. CPK-MB was normal, LDH, SGOT, everything was normal. The ECG showed ST elevation in V1, V2, V3 and T inversion in AVL, V1, V2, V3. Right? So you can understand that patient had taken these medications, but in spite of that, he had angina, and that is the reason that he came. That's exactly what I was trying to say. When there is limitation, in spite of taking modern medicine, if they experience symptom, that is the time they want to come and meet you. The diagnosis is stable angina pectoris. Now, Just to give you a brief revision, anginas occur because of imbalance between myocardial oxygen demand and supply. It is a common cause of death in developed countries. The peak incidence is between 60 to 70 years of age, and men have more prediction than women. Hypertension, sedentary life, diabetes, smoking are all, hyperlipidemia and hypertriglyceridemia are all risk factors. What is more important is those two center figures that you see, plaque disruption and severe fixed coronary obstructions. This is the level at which you get angina. And the only next thing that can happen is formation of a thrombus, which will lead to occlusive thrombus causing infarction. So you are somewhere in middle and you are at a level where you may revert, you may not be able to revert, but definitely you may allow not the further stages not to develop. The result of IHD, of course, as you can see, acute myocardial infarction, sudden cardiac death, and chronic ischemic heart disease. These are the two things. There are three types of angina: stable, as you saw in this particular case, unstable angina, and Prinzmetal's angina. Okay, typically it represents reversible myocardial ischemia. If it is an irreversible myocardial ischemia, it will progress into an infarction. 75% fixed coronary lesions will be usually seen when you have these kind of symptoms presented by the patient, typically treated with nitroglycerin and vasodilators. Unstable angina has a crescendo and a decrescendo. So it will show a rise and a decrescendo. Usually will have increasing frequency with progressively less work due to acute plaques. So there is a chronic CHD, and then suddenly you see an acute plaque coming in that causes the whole cardiovascular system to get destabilized, and that's where you get unstable angina, usually associated with a microthrombi or an embolism or an vasospasm. Whereas Prinzmetal's is substernal chest pain occurring even at rest due to vasospasm. Okay, where you may not be able to demonstrate a complete block in an artery or a significant lesion in a cardiac artery, but it is mainly occurring because of vasospasms in the cardiac coronary arteries, pathogenesis of which is not known, usually treated with calcium channel blockers because they prevent the vasospasm. So this is how these three anginas present. Now, ours is a case of stable angina, which means a certain amount of coronaries are already blocked, right? So there is a certain amount of irreversibility in terms of pathology, but ischemia can be reversed, and hence you can prevent the patient from going into the further myocardial infarction. Now, how do we approach this? I'm not discussing the materia medica. It's not very relevant here because we are not. So patient was, lean, thin, chilly patient, 50 years old, from a poor community, earns around 40-50 rupees a day. Father was he went through a strict childhood with father being very strict. And fear of dark, fear of animals. When he goes to the jungle, usually that kind of a thing will not be seen. And though he is poor, he would give money to poor people, his own people, and very, very anxious about his own illness as well as anxious about the illness of others. And very image conscious, very, very helpful to others as well. And very sympathetic to others. And in spite of the fact that he is poor, he is more than happy to help other people. And there are dreams of dead father and dreams of dead grandmother. Now, there are two aspects to this case. One is, what do you do when there is acute anginal episode, and what do you do to prevent further anginal episodes? There are two aspects of management. So you look at this chest pain, which is pricking type, radiating to both the shoulders. So pricking pain radiating to both the shoulders. The rest, if you see, are more or less common symptoms. But the peculiar thing is pricking pain in the chest radiating to both the shoulders. Now, if you repertorize, you get these four remedies: Pygelia, Cactus, Calmia, and Bryonia. Now, just by looking at the sensation, you will be able to differentiate. Let's first differentiate calmia. Calmia is, all of them have got sphere of action on the heart, right? But calmia is all about myocardium and valves, and the peculiar sensation that calmia experiences is neuralgic pain with numbness, which radiates down the arms, especially the inner aspects of them. So that is what calmia is, and calmia heart flutters. So you will see a lot of tachycardia and anxiety that happens with lot of palpitation that happens in calmia. So a person presenting with chest pain radiating down the arm with numbness, that numbness is very, very important, with flutter in the heart, is one that requires calmia. Cactus is all about constriction. The general sensation of cactus is all about constrictions, and cactus usually comes up periodical spasmodic pains. So you will see cactus patient saying, I had pain, then the pain disappeared, and after an hour it recurred again. And then it disappeared and then it recurred again. And it is killing me, it is constricting me. There's constriction in everywhere. General sensation of cactus is about constriction. And you will see acute atheromatous plaques. So you will usually see cactus when there is unstable angina, because those are the pains which come and they disappear. Right? With a characteristic sensation of having been constricted feeling. Cactus doesn't radiate much. Cactus is stable local pain, but constricting and occurring periodically. So there is a period of pain and then there is period of no pain. And that's typically cactus. Usually you will see when there is a dislodged emboli and a dislodged microemboli, this kind of episodes of waxing and waning will come. And that is the time when you have to use cactus. Now, bryonia is again stitching pain, but is extremely localized. Bryonia is a stitching pain, but only localized. Bryonia rarely radiates. So you see, cactus and bryonia don't radiate. Cactus is constrictive, bryonia is stitching, but worst by slightest movement, right? So if you can divide these 4 remedies into remedies that radiate, remedies that don't radiate. Remedies that don't radiate with constricting pain, cactus. Remedies that don't radiate with stitching pain, bryonia. Now go back to remedies that radiate. Remedies that radiate along the arm with numbness, calmia. And remedies that radiate with stitching pain to the shoulder is spigelium. So it's very clear, like the clinical differentiation is very, very clear. If you go back to your materia medica, you will get confused because all of them will be shown heart remedies, nerve remedies, everything will be there. But calmia has valvular affection. Cactus has microthrombitis and clot dislodgement. Bryonia is more pericarditis. And because bryonia's action is on the pericardium. Bryonia is more lateral wall infarction with pericarditis. Namaste. And if you see spigelia, it is more cardiac nerves and radiation of angina to the shoulders. So we, in this case, gave spigelia to this particular patient. Now, spigelia 200C was prescribed. Okay. Now, miasmatically, if you see, it's a very slow evolving disease, which is gradually progressing. And you can see that there is a certain part of reversibility and certain part of irreversibility. The structure in the coronary is not reversed, but the ischemia can be reversed periodically. So now what is more important is we have now 2 remedies, right? We know causticum looks like the constitutional remedy and spigelia looks like the remedy for the angina. The dilemma is always which one to use and when to use which remedy. Right? So we introduced spigelia 200C in multiple dosages. Unlike the previous case, even though the hypertension was 180 by 110, 120, we just use a single dose because we knew it was acute, it was soric, it had a triggering factor, and that it would settle on its own. So we didn't have to repeat. Here we can clearly see this is a psychotic illness with structural changes, and there is very little scope for improving the ischemia, and there are certain structural changes in the coronaries as well. So we used Spigelia 200 multiple doses. Spigelia was continued in same potency and same doses without changing, even though the patient would sometimes say the pain has increased or pain has decreased. We continued Spigelia in the same rhythm continuously. This is what we call bulldozing. It's essentially you don't jump with the symptoms. You don't dance with the symptom. You address the pathology and don't continue the same dosage, and watch for the frequency of how much of angina is coming and what is the intensity of angina. Now, gradually the effort tolerance improved. What is effort tolerance? The earlier patient used to walk for 10 minutes and get angina. Now the patient could walk much more. Now, this is the learning part. We thought that the patient has improved with Spigelia. So typically what we do is we have the apprehension or whatever we call it to give that constitutional remedy. And every time we prescribed a constitutional remedy, the angina recurred. Right? Now, this is the important key point that I'm trying to put forth to you. When do these kind of situations happen? You know the constitutional remedy. Your constitutional remedy is supposed to help the patient, but every time you are prescribing, the angina recurs. And every time you continue with Spigelia, the effort tolerance improves and the angina does not recur. Now, how do I go about handling this particular situation? This is the scenario that we need to understand. What we learned is do not prescribe constitutionals to these patients, even though you might know the constitutional remedy. Prescribe a related remedy to the constitutional. Now go back to Boger-Bonningerson concordances and check for relationship between causticum and Spigelia. And you will find causticum, Spigelia under references of cardiac illnesses in causticum. So that is the time we continued only on Spigelia, not introducing constitutional remedy, in spite of the fact that we knew that the causticum was the constitutional remedy. Now, why? Once again, once the Spigelia was started, the pain stopped. Again, constitutional remedy was introduced and the pain recurred. So this time we went from 200 to 1000 C of Spigelia. Why? Now read this. Kent's lectures on homeopathic philosophy, 6th observation. I'm sorry, I might be wrong in this thing. There are organon teachers. If I'm wrong, just correct me. It is too short amelioration in chronic disease. It means that there are structural changes and organs are destroyed or being destroyed in very, very precarious condition. In such conditions, constitutional deep acting medicine should be avoided. And a superficially acting remedy related to the constitutional medicine will provide the required relief. I hope you understand what I'm trying to say. So what is the repertory to be looked at? Bonningerson's concordances, right? You will get this reference in that. Also understand treatment of any homeopathic disease is not just about repertory or materia medica. It is a trio of materia medica, repertory and organon. So if you have not understood this reference from organon and applied it, you will continue to give constitutional remedy hoping that it will improve and one day cause what is called as prolonged homeopathic aggravation or killer's aggravation. Please understand you are treating cases which are structurally damaged. The vasculature is already compromised and further triggering it to get compromised would be a problem. So you are dealing with a very finer thing, right? You have only scope of improving the ischemia or myocardial hypoxia. You don't have much scope to change the artery here. So your scope is very, very limited. If you try to trigger the thing too much, there is a possibility that you will cause these kind of accidents. This is the caution that we should learn. And these are all there in our textbooks that are mentioned over there. Now, here's another case, known case of hypertension. And she was on constitutional treatment. but came down with an acute episode of chest pain. The pain was radiating to the dorsal back and had a constricting effect on the pain. Now, I'm not going to go into the constitutional treatment discussion, but the main thing was, see, her ECG is normal. 2D echo is fine. Earlier ECGs and 2D echoes were all normal and fine, but now the ECG shows changes. Her constitutional remedy was natrum mur. Okay, we are not going to discuss natrum mur here. What is more important is what she presented is gripping pain in the chest and tingling over the right arm. Most important, very tight gripping pain over the chest. Clearly, there were atherosclerotic changes. And this is what I say is, typically a Prince metal angina. You will see ECG, earlier ECG is all normal, and the current ECG will suddenly show changes because that is where the vasomotor constriction has happened. And there is a microvascular dislodge or something that is going to happen. So these, again, if you repertorize, you get all these remedies: cactus, crataegus, naja, and arnica. How do you differentiate? Again, I think we discussed cactus. Cactus is all about localized constricting pain, sudden, where you will see spasm or a microthrombi getting dislodged. That is where the cactus comes into play. So in this case, naja is all about irregularity of the heartbeats. Okay? Irregularity of the, you will see that there are irregular forces and more important, the endocardium getting involved. So if you see a transmural infarct and endocardium getting involved, that is where, if your ECG shows that, that is a situation where you will use naja. Arnica is when it is just about to get blocked or it has already got blocked. That is where you use arnica as a thromboembolic thing. So here in this case, we gave cactus 200, single dose. Again, why are we giving single dose? Because this is Prince metals. What is a Prince metals angina? It is not a irreversible block. It is an angina caused because of severe sudden vasospasm. So it's a completely reversible phenomenon. Right? So if you ask me whether do you give multiple doses in all cardiac cases, not really. If you ask me whether do you give only single doses in all cardiac cases, not really. So it depends on how you assess the case, how you assess the clinical and pathological correlation of that particular case. Right? So we gave acute single dose of cactus 200 single dose and followed it up with the constitutional remedy. Now, this is a case of cardiomyopathy, okay, who presented with CCF. So patient had already had basal creps, BP was 150/80, and there was systolic murmur as well. There was large cardiac dullness on examination, and on investigation we found out her hemoglobin was 7. She had severe anemia. Her RBS was 82. Her creat was 2.8. So there was chronic renal failures setting in. And kidney showed, USG of the kidney showed bilateral contracted echogenic, hypoechogenic kidneys with loss of corticomedullary differentiation, which essentially means chronic renal disease. X-ray showed cardiomegaly and left ventricular hypertrophy in the ECG with lateral wall myocardial ischemia. 2D echo showed dilated cardiomyopathy with severe LV systolic dysfunction. LV function was only 15%. So this patient has come to you. Now, essentially, if you see, this is multisystemic involvement. There is congestive cardiac failure, dilated cardiomyopathy, myocardial ischemia, anemia, and chronic renal failure. And there is no characteristic symptom for you to prescribe. So what are you looking at now is what are the pathologies that are existing together, right? 1 is a renal disease, 2 is anemia, and 3 is dilated cardiomyopathy, correct, with ischemia. So these existing pathology gives you the totality. So you need a remedy where these three pathologies exist simultaneously. No characteristic symptoms are there. So the susceptibility is low. The miasm is syphilitic. Right? You saw first case of psoric miasm, second case, couple of cases of psychotic miasm. Now what you are seeing is a case of syphilitic miasm. So what do you prescribe? So we prescribe Calcarea Rs 30. If you look at Boger, so in this earlier you need a Kentian approach where you see causation and characteristic mental symptoms. The second case is you need more Boger-Bonnigesson approach. And now when you have these kind of pathologies, you need what we call as a bogus approach. So anemia, nephritis with albuminuria, and dropsy, heart disease in. This is exactly what Boger writes in Calcarea Rs. So we started with single dose and then slowly gave multiple doses as the patient tolerated each dose. Right? Just because there is huge pathology, don't try to overstimulate the system. These systems are fragile. Start slowly with 1 or 2 doses. See how the system tolerates the dose. And then over a period of time, go on increasing your potencies and dosages. Right? These are cautions that we need to follow in cardiac cases, because overstimulation in a structurally compromised case can always lead to what we call as the prolonged aggravations and the killer's aggravation. Have you seen a killer's aggravation? I have done 2, 3, so I know very well that we can do this. So if somebody tells me homeopathy does not have any adverse effect, I personally would oppose that particular thing. A homeopath can create an adverse situation for a patient. Right? So being cautious is very, very important. Homeopathy per se may not have adverse effect, but homeopathic doctor can create adverse situations. Right? And I would be, candid enough to say that when we have these kind of pathologies, with my over enthusiasm in my earlier cases, I have landed patients in trouble, which we took long time for us to recover them back. So prolonged homeopathic aggravations and killer's aggravations are a reality in practice if you are in a hospital setup and where you see critically, poised patients. So here, what did we see? What we are seeing here is using sectoral and organ remedies to alleviate the symptom and add life to the patient's. This is about a 2-month-old child who had cardiomegaly. Hemoglobin was 10.9 and had acyanotic heart disease. And presented in congestive cardiac failure with right paracardiac pneumonitis. What is our role? Our role is to prevent the failure from progressing and take care of the right paracardiac pneumonitis. The failure is because of pneumonitis. Infection precipitates failure. So failure is because of pneumonitis. So how do we handle this? 4 symptoms were there. Cough was aggravated 3 to 4 a.m. Heart affections leading to dropsy, weakness and feebleness. Pulse was weak and feeble, dropsy and edema, heart affections cough aggravation 3 to 4 a.m. and heart and lung affections simultaneously. Which remedies would come to picture? Kalikap. Correct. Kalikap is there and correct. So these are the remedies that came. Kalikap, lycopodium, R-thiode and ammonium carb. Now, if you look at 3 to 4 a.m. aggravation, you can also add anti-Mars to this if you wish to. But this is your basic differentiation between the remedies. Kalikap, lycopodium, arsenic, iode and ammonium carb. Kalikap also has dropsies, right? But Kalikap dropsies are loculated. They don't have generalized dropsies. And the heart is irritable and flutters. So you'll see a lot of tachycardia, not weakness. Kalikap heart is reactive. It reacts to the situation. R-thiode heart is also reactive, right?
What is feeble and sinking with lack of vitality is ammonium carb. So you will see lot of edema, feeble, sinking, worse 3 to 4 a.m., cough worse by 3 to 4 a.m., antimony Rs, antimony tart, ammonium carb, kali carb. These are your remedies. You can differentiate them right now, right here. Kali carb has loculated pericardial effusions with irritable heart. Arsenic, antimony Rs, essentially, there is a lot of chest infection which precipitates failure in a degenerative heart, whereas ammonium carb is pneumonia with cardiac affection where the patient is sinking and feeble and with lot of dropsy. That is ammonium carb. Right? So this patient received ammonium carb. I'm not going through the details of materia medica now. So this patient received ammonium carb 30 in multiple dosages for 3 days. Now, what is important here is to understand how a soric response comes out, how a psychotic response comes out, and how a syphilitic response comes out. Okay, I think I've shown you all the 3 levels of cases that you can see in cardiovascular diseases. Syphilitic response, you have to be very, very careful because you are on a brink, a slight push and your patient will go into a solid aggravation. Psychotic, you can bulldoze, right? That's what we said, no? We gave Spigelia in multiple dosages, right? And SORA, you don't need to really do much. You just need to trigger the right reaction and stay away. Syphilis, be cautious. Psychosis, you can bulldoze. And SORA, you really don't need to do too much. You just trigger with the right single dose and stay away from it. The rest, the system will take care of itself. Right? So, final action was ammonium carb 13 multiple dosages. And within 48 hours, we could take care of the pneumonia and the cardiac failure settled down. Now here, we did not want to treat this case further because he had a clear acyanotic heart disease for which a surgical intervention was required. So what we managed is the medical part of the cardiac emergency and referred the patient for further surgical intervention. So this is where the surgical part comes into picture. And here's the fun part of it. This is the last case and I'm going to run through this. This patient was on operating table when I got a call. The point was patient had chest pain, had an acute myocardial infarction, has undergone a CABG, and now during the second CABG, he had what we call as supraventricular tachycardia while on table. And the blood pressure he had triple vessel disease with ejection fraction of 20%. His current diagnosis was acute myocardial infarction causing arrhythmia, leading to congestive cardiac failure and cardiogenic shock. And all the antiarrhythmics were used, and for some reason, there was poor response to thrombolytics, nitroglycerin, inotropes, and even the antiarrhythmic agents. And this is the time when he was pulled out of the OT. Just before he went into the OT, he got it. He was pulled out of the OT and he was in ICU. And the cardiac surgeon was very clear. I can't touch a heart which is into arrhythmia. So if we can revert the arrhythmia, the patient can undergo a CABG. This is the situation. So poor and guarded prognosis was explained to the patient. And the cardiologist said, you have 5 minutes. You can't take a long history in this case. You have five minutes. If you can make out what you can give in 5 minutes, I'll be happy to give that medication because all what I have done is not worked. And there is a very poor prognosis in this particular case. So the cardiologist himself gave these observations. He behaved like a child, extremely uncooperative, acute anxiety and fear of disease, constantly asking whether everything would be okay. And due to anxiety, there was acute angiospasm on the table, which was demonstrated during angiography. Refused angioplasty on table and was brought out. Now, we took some history from the relatives, and it looked like he was more like an Aurum Met patient. But what was more important is what we saw during in the ICU. Fear of death was evident. There was fear of failure. He was denying that I had nothing to do with this illness. I don't have any illness and I need to get out. And one particular symptom that he spoke about was that I don't trust these doctors. And they might do some harm to me. I don't trust them. And constantly he was holding his hand over the heart here. Okay. And during the infarct, developed what we call as murmur during an infarct. Essentially indicates that the chordae tendineae of the walls have also infarcted, and hence there is a transient ischemia in the chordae tendineae itself. That is the reason the walls are not functioning. So what do we have? Spasm, mistrust, suspicion, avoiding that there is, denying that I have any particular illness, and sitting with hand on the left shoulder, left side of the heart. You check the remedies and you will see this very typically. Sits with hands on the left side of the shoulder, left side of the heart. Okay. Only remedy is naja. Now you look at other symptoms. Valvular involvement with infarct is naja. And most important thing, arrhythmia is all about naja. So this patient received single dose of naja 200C. Now what happened after that is the arrhythmia stopped in 25 minutes post naja. Patient was taken up for surgery. The surgery went through well. And post-operatively, on the second day, again, the arrhythmia recurred. And that is the time the cardiologist clearly said, I'm not trying my antiarrhythmics. You give that another dose of naja. We gave another dose of naja in the same potency. And this time, within 7 to 8 minutes, the arrhythmia stopped again. So what I'm trying to say here is, you will see that there are different situations and different conditions in which a homeopath may be called to the hospital to treat cardiac diseases, or maybe even in your OPDs. So this was right on the table, right? Then there was an earlier case where we did medical management and referred the patient to the surgical part. Then there was irreversible part in cardiomyopathy where there was very little to offer in modern medicine. We could handle the entire case. So you will see that if you ask me to define scope of homeopathy in cardiology, there is no one single line answer. You need to assess the case, understand your scope well, understand the scope of surgery in those particular cases, and then take it forward from. But in conclusion, homeopathy has distinct strategies of management. I showed you all the strategies of management only. I was not here to discuss so much of materia medica, but the clinical part of it. Primary prevention is possible with homeopathy. Secondary prevention with lifestyle modification. We saw 2 cases of angina. Symptomatic relief in patients with acute cardiac distress, the cardiomyopathy as well as the arrhythmia that we saw, and palliative care in terminally ill cardiac patients. There are clear scope of homeopathy for all these cases. Although there is conceptual similarity with modern medicine in clinical diagnosis, investigation, and prognosis, homeopathy offers a dynamic solution which is much beyond the pharmacological solutions offered by modern medicine. Does that mean we criticize? No. There is a reason, there is a scope for them to handle certain type of cases which might be currently very large, but there is good scope for homeopathy to intervene when there is these special conditions that come up. Homeopathy acknowledges its limitations and resorts to surgical interventions wherever indicated. So that gives you the balance that is there. What are the important concepts that we need to understand? No acute cardiac distress should be treated in isolation without taking into account understanding of the chronic miasmatic state. Don't treat it in isolation, just treating this particular episode. Understand the full case and then treat that particular episode. Should have full knowledge of when to use acute remedies. We used acute remedies in certain cases. We used phase remedies like spigelia. We use deep acting remedies, and we use constitutional and organ remedies like calcarea ars as well. Miasmatic understanding is very, very important. Most importantly, most cardiac cases will show you few characteristic symptoms. So your knowledge of the pathology becomes very, very important, and clinico-pathological correlations become very, very important for you. Most of the cardiac cases will come to you in psychotic and syphilitic phase of their miasmatic stage. And that is why you need to be careful with understanding how to manage psychotic and syphilitic cases. Scope and limitation, I think we discussed that in the current thing. Most important, I believe that there should be training programs for homeopath to understand, because you need a lot of clinico-pathological correlation to understand what exactly you are treating. It's not just about giving the remedy. It's about how much to give, when to give, whether to give a single dose, whether to give multiple dosages, when to stop. When do you acknowledge the danger that your constitutional remedy can create more problems? This is something that we need to train to our homeopathic doctors. And for that, clinical examination, understanding 2D echoes, understanding ECGs, understanding all these become very, very important. You can't be expecting a cardiologist to tell you, oh, this is the finding, now you give homeopathic remedy. That doesn't happen. Nobody's going to do that. So it is our job to take ourselves and improve our knowledge base to that particular level. No cardiologist was guiding us when we were treating these particular cases. We will get a set of reports. You need to interpret those reports and understand how to apply that into homeopathic therapeutics. So this is all that I wanted to share with you. There is much more that we can do, but in the given period, I think this is all that we can say at this point of time. I thank the organizers for giving me this opportunity. And I acknowledge all my organizations, the REV Integrative Healthcare, which we run at Yashoda, gyms, of course, and my earlier organization, MLW Memorial Trust as well. Thank you, all of you. Thanks a lot. How do I stop sharing? Yeah, I'll leave. Can we remove this? Can you do that? No.
Thank you, sir. Thank you for your elaborative session on cardiac diseases and management through homeopathy. We acknowledge the presence of our guest of honor, Dr. N. Lingaraju, sir. We acknowledge the presence of Dr. M.N. Raju, sir, IIHP Telangana State President, Dr. Mahesh Pagadala, sir, National Finance Secretary, Dr. Madhu Varanasi, sir, Twin Cities IIHP President, Dr. Noman Siddiqui, sir, Dr. Shrikant Kulkarni, sir, and Dr. Gayatri Prasad, sir. Now proceeding with our session, now I call upon Dr. Mahesh Pagadala, sir, to give excerpts of International Ayush Conference, which was held in Dubai.
Good evening, everyone. All senior homeopaths and my fellow friends, ladies and gentlemen, most of them are homeopaths. Thank you for inviting me just to give a brief extract about Ayush International Conference, which was held in Dubai on 13th, 14th, 15th of Jan. I feel little privileged and happy that, and proud also. From Hyderabad, we have represented 3 doctors. Dr. Praveen Kumar, our senior homeopath, myself, and from CCRH, Dr. Himabindu. We 3 represented from Hyderabad, and even I can say is from Telangana also. So that is a proud moment for us. And from India, naturally, there were around some 150 doctors, and all over the world, other homeopaths also they have come. And this is the second international conference. First conference, it has been held in 2017. So after that, the second conference was scheduled. Due to COVID, it was being postponed and it has been conducted in 2024 Jan. So here, this has been organized by Government of India, Ayush Department. So it is a proud moment that India is promoting Ayush totally all over the world and taking the platform of Dubai being the center of over there. So attracting all over. Now, previously, Saudi was a different state where even homeopaths used to practice was a very difficult task. Even sending homeopathy medicines over there also, it was a difficult task. Now they are inviting homeopaths, Ayurveda and Unani, Siddha, and even yoga is being more, it has been the key role which is playing all over the world. Thanks to Dr. Narendra Modi, our Prime Minister, bringing Ayush into a one platform and one shelter in one roof like that, where we all are able to give a different, each pathy, they are giving their success cases over there. In such platform, we have observed there were a lot of Ayurvedic doctors and Ayurveda was promoting a more. Only the wonder what I have seen is, and very sympathetic to see over there is, you in the exhibition, it was even an expo over there. There were so many Ayurvedic products over there and different Ayurveda related research, their products, spas and everything they were disclosing. Only there were 2 stalls of homeopathy. One was Byron. They were representing, another was SBL. Only these 2 companies were representing homeopathy. And Unani, of course, it was only one. So still we need to encourage. The government has given, they are promoting us. So even from all over India, we homeopaths, we should come forward to show our cases, how we are able to show success with the help of homeopathy. That is what I wanted to say is, you can, all the doctors, young doctors, there are so dynamic doctors who are upcoming doctors also with different cases. Each colleges are having such a wonderful setbacks, and the students, I think it will be, I think in the next 3rd international conference, I would like to see all the colleges to come forward with their supporting hands, and students, they can give different cases so that we can show the homeopathy in one level. We have to show more than that. Next to Ayurveda, it is homeopathy, Let us show even we are better than everyone also. We have to show our priority also. So like, just to tell these few words about that one. And thank you for giving this opportunity. And there, my case, I presented on diabetic gangrene treated with homeopathy. There are so many different cases. Really, it is a such seminars or conferences, you can learn a lot with so many people coming all over from Kerala to up to Punjab. All the doctors they have come and all over even from India, not only from India, even from Saudi also, Abu Dhabi, Oman. There are doctors who are practicing homeopathy. So this is what is going now. That is a change. The trend is coming up. Let's see and hope homeopathy will rule out all over the world and it will be the number one in giving this treatment and at the best path for everyone to save the humankind. Thank you very much.
Thank you, sir. We acknowledge the presence of Dr. Satish Krishna, sir, Twin Cities IIHP Secretary. Before proceeding, now I request our guest of honor and other dignitaries to please pay tributes to Venibushan, sir. Thank you, sir. Now I request Dr. Madhu Varanasi, sir, Dr. Satish Krishna, sir, and Noman Siddiqui, sir, to speak about the upcoming conference of IIHP. I request Dr. M.N. Raju, sir, to please accompany.
Just, I'm just only just testing of the very much specific. My dear esteemed doctors, good evening. I am honored to speak to you regarding about our important upcoming national conference organized by Indian Institute of Homeopathic Physicians. It's our privilege to be here associated with our HMAT association. On behalf of IASP Greater Hyderabad and State Telangana, we are very much delighted to announce today's scientific seminar in the month of February 10th and 11th at Satya Sai Nigamagam. It's a very popular place in Hyderabad. You know, IASP is one of the world reputed organization. Generally, they organize quality seminars for the betterment of homeopathic community. We are assuring you that we will uphold the same tradition in our future endeavors also. This seminar has been arranged at the request of Telangana Homeopathic College principals. This initiation was taken by Dr. Linga garu, Dr. Pawaskar sir, when we are organizing our state conference. By seeing this meticulous response from the conference, they planned. Even central committee also decided to organize this seminar in Hyderabad. So, resource persons are coming from across the India. They are well noted, renowned doctors, national, international doctors also. So, national doctors also are coming there, coming in our conference. International doctors also there. So, I am requesting all the members of the doctors and their please promote and encourage your students and practitioners for the success of our seminar. Here, moreover, so your presence is essential for us for enlightenment of our community and also for the success of seminar. Each one of you is a vital thread in our journey. Be the driving force of change, be the catalyst for inspiration, be the ambassador of our progress. Being a joint secretary of HMAT, I am requesting all the family members of my HMAT association also, please enroll your names and travel along with us for the development of, for betterment of homeopathy. This is my humble request. I'm hoping your cooperation and support for the success of our seminar. Please. Thank you. I am inviting all the members of HMAT, Gopalakrishna garu, Durgaprasad, remaining doctors also, and our principal Dr. Linga garu, and our Pawaskar garu, please, and Dr. Gayatri Devi, and our finance secretary Mahesh Pagadala, and remaining doctors also Padmaja, and MN Raju State is also there. Please come on the dais for our brochure presentation, please.
I would request all the people to enroll your names because this is a 2-day seminar and the practitioner fee is 2,500 and the IHP members, they need to pay only 2,000. That includes breakfast for 2 days, lunch for 2 days with high TN. And we have around 16 to 19 speakers who have been coming on to this seminar. So you will be very much delighted with all those experiences that they have been experiencing there. I would request some person from the HMAT to take the responsibility and pass out that amount to the IHP for the registration, please. Because we have the online registration and the payment is completely online. We don't accept any cash here.
I request everyone to please be seated. Sorry, sir. Proceeding with our next session, Dr.C.Hering Excellency Awards. For this, I call upon Dr. N. sir to come on to the dais. Next, I request President of our association, Dr. Gopalakrishna sir, onto the dais. Now I call upon Secretary of our association, Dr. G. Durgaprasad Rao sir, onto the dais. I call upon Dr. Rajashri ma'am onto the dais. I request Raghuram sir to please come on to the dais. Before going to the awards presentation, I request Dr. Goutham sir to please speak about Dr. Constantine Herring.
Good evening, everyone. On behalf of Homeopathic Medical Association of Telangana, I, Dr. Goutham Rallabandi, welcome you all for the second session for today, that honoring our teachers doing their jobs at various institutions. And I'm privileged that the awards we are presenting today on behalf of the association to the teachers. Almost all of them are my teachers. So it's a privilege for me. So let us see, as we are giving this award as a mark of the birth month anniversary of Dr. Constantine-Hering, who is father of American homeopathy, born on 1st January 1800 at Germany. Now, if we are relating to homeopathy, then we must have definitely heard about the Hering's Law of Cure, 10 huge volumes of guiding symptoms of our materia medica, domestic physician, etc. As we know, he was the first one to start the decimal scale potentization. He was the chief editor of North American Homeopathic Journal. While he was working as an assistant to Dr. Heinrich Robbie, he was given this task to write a book to prove homeopathy as a quackery. But while he was collecting the information, referring to the various literatures available then regarding to homeopathy, he was greatly influenced by the different methodologies of drug proving and also the practical aspects. So he was influenced by them. He began to practice the same experiments on himself, the results of which began to sense some truth about homeopathy in Hering as well. So that is how, as he was doing many experiments, he slowly turned to homeopathy, and we know how great pioneer he is. So this is just to remember Dr. Constantine-Hering, on whose name we are going to present these awards. Thank you.
Honorable guest ను పిలిచి మమ్మల్ని పిలిచి ఇచ్చేయచ్చు.
I request our guest of honor, Lingaraju sir, to please present the mementos to our speaker, Dr. Navin Pawaskar sir. I request Dr. Navin sir to please come on to the dais. Now I request Dr. Mahesh Pagadala sir to please come on to the dais for the felicitation.
Registration.
Sir, నేను రాస్తాను. Now we are having one professor from each of the homeopathic colleges in our city, for whom we are awarding with Dr.C.Hering Excellency Awards. Now I request Dr. Yelamanchali Ramanjanayulu sir, Professor and HOD of Department of Organon of Medicine in JIMS Homeopathic Medical College, to please come on to the dais. Was an assistant and associate professor at Guru Raja Homeopathic Medical College and associate professor at Dr. Allu Ramalingaya Government Homeopathic College, Rajahmundry. Next, I call upon Dr. Lagnajita ma'am to please come on to the dais. She has completed her BHMS from MHMC and College and Hospital, Orissa. Completed her MD from JSPS Government Homeopathic Medical College. She worked under Dr. L.K. Nanda in Bhubaneswar. She initially worked as a contract lecturer in JSPS Government Homeopathic Medical College, Gudivada Homeopathic College and Guntakal College. Now she is working as professor in Organon of Medicine at Hamsa Homeopathy Medical College and Hospital. Next, I call upon Dr. G. Madhavi ma'am to please come on to the dais. She is the professor and HOD of Department of Organon of Medicine in Dev's Homeopathic Medical College. She has secured her top marks in final BHMS from Kadapa Government Homeopathic Medical College. She secured first rank in MD from JSPS Government Homeopathic College. She published many articles in different journals. She is an internal and external examiner for Dr. NTR and KNR University of Health Sciences. Next, I call upon Dr. N. Arundhati ma'am to please come on to the dais. She has completed her UG and PG from JSPS Government Homeopathic Medical College. She is at present an assistant professor in Department of Organon of Medicine and Homeopathic Philosophy at JSPS College. Initially, she worked as a contract lecturer. Then her post was regularized. She is even a PG guide in the college. Next, I call upon Dr. Gayatri Prasad sir to please come on to the dais. He is a professor and HOD of Department of Organon of Medicine at MNR Homeopathic Medical College, Sangareddy. He was the best outgoing student in BHMS. He initially joined in teaching in Dev's Homeopathic Medical College, received the Best Teacher Award from MNR Educational Trust. He published many articles and presented papers statewide, national-wide and international-wide. I request the family members of sir to please accompany the sir on the dais. Next, I call upon Dr. Shrikant Rao Kulkarni sir to please come on to the dais. He is the professor and HOD of Department of Organon of Medicine at Guru Nanak Homeopathic Medical College, Ibrahim Patnam. He is currently pursuing his PhD in Organon, gold medalist, being the university topper in his UG, resource person at various homeopathic seminar platforms, and he has conducted series of workshops. Now I request our honorable guest, Dr. Lingaraju sir, to please address the gathering.
Good evening, all of you. Good evening, all of you. Respected dignitaries on the dais, the Association of HMAT and the management of private homeopathy medical colleges, the director of GIMS, Dr. Navin Pawaskar ji, and the principals of other homeopathic college. I think only Murali is vice principal in Dev's college, and no one I am seeing the other principals. So anyhow, and other dignitaries on the dais of the dais, and the homeopathic practitioners. Today I am very happy because the Homeopathy Association of Telangana is conducting the seminars in respect of our stalwarts and homeopathic physicians and the sympathizers of homeopaths, and also celebrating the commemorates of our C. Herrings. And I think today, this month is also Farrington birthday. Huh? Farrington, birthday name? Ha, Herring. Herring and Farrington, two birthdays on 1st January. 1st January, huh? Herring and Farrington. Tell me, organ teachers, just now we have, so the celebrating of these commemorates and the, this is a very good practice. And also the HMAT is giving the good services for conducting the free homeopathic medical camps and conducting the regular OPDs in the campus, and also seeing the welfare of the homeopaths. This practice is, we are also encouraging the HMAT, and so many times HMAT is giving representation for financial assistance from government, but that process is not continuing. That is sorry. And also encouraging the teachers working in various colleges and giving the felicitation and appreciation certificate mementos to the teachers. That is a very good practice. And we are from the government, we are also encouraging the HMAT. And also I request the Homeopathic Association and the homeopathic physicians give some suggestions to the government. Recently, we have conducted in a meeting for the Clinical Establishment Act, that we are framing the rules. What is the procedures? What are the guidelines to government for implementing the GO 66, 65 and 64? In that GOs, some objections raised our homeopathic fraternity not to implement that guidelines to our clinics. In this regard, last meeting also we have discussed the committee members, and day after tomorrow, that is on 31st also, we are conducting another meeting, second meeting, to offering these guidelines and suggestions, and so that if any suggestion regarding the Clinical Establishment Act, I request the HMAT give any suggestions regarding that. That oncoming meeting is going on 31st of this month. So not only that, and we are also very interesting to separate the Homeopathic Council. That guidelines already prepared. The Nalsara University of Law, as per the Act, they are prepared in a draft guidelines. Accordingly, we are also the draft guidelines of our Kerala state is also conducting a separate council for homeopathy. Same guidelines, including our Act guidelines, and combinedly, we are framing the rules for implementation of Homeopathic Council in the state of Telangana. That also, within few days, it will be also coming to draft guidelines will prepare and sent to the government for approval. So in this aspect, I request all the homeopathy physicians, stalwarts, and practitioners, and the associations. If you want to give any suggestions regarding this, please kindly put on paper and submit the things to me within few days. That will be helpful to our homeopathic fraternity. Also, I request the things which are continuing in the HMAT, you continue the same thing, then we will support from our homeopathy side, from the government side. And those who are coming here in the evening, taking the lot of time and submitting their presentation here, everybody, each one, I congratulate to everyone. And also I congratulate the management who are conducting this program. I request these organizers, please continue the same thing at least once in a fortnight or once in a month. That will be an inspiration to our homeopathic doctors. Thank you, Ananda.
Thank you, sir. Now I request the dignitaries on the dais to felicitate our guest of honor, Dr. Linga, sir. I request Dr. Raghuram sir to please give the vote of thanks.
Good evening, everyone. Dr. Navin Pawaskar, sir, thank you for your wonderful presentation today, sir. You gave us a lot of insights into various facets of homeopathy and the possibilities of homeopathic treatment in various diseases of homeopathy. Also, Mahesh Pagadala, sir, thank you for giving us experience at the Ayush conference at Dubai. Also, Dr. Linga, sir, thank you for gracing the occasion and helping us with today's occasion, sir.
Thank you.
And also congratulate all the professors of Organon of Medicine and various homeopathy colleges for giving us an opportunity to facilitate yourselves today for today's function, sir. Also, I'd like to thank Team IHP for gracing this occasion and also wish all success for your upcoming conference. Also, we thank all the team IIHP for holding such a wonderful seminar. Thank you so much. I request everyone to stand up for the national anthem, please.
National anthem.